The chronicity of the stress at this point is going to play a toll on their physical health. They might start to develop GI issues, chronic headaches. They're going to isolate even further, doubt themselves, feel pessimistic, and there's can be some neglect of personal needs and self-care. People are at risk for feeling and experiencing burnout, even though it's not the traditional occupational context of working in a cubicle in an office and earning a paycheck. I don't need to find a week to get away on a vacation. I don't have to have thousands of dollars to go on a cruise. And that's not going to make the big difference, because you're just going to return to the same set of circumstances and work stresses that you have. But what are those small, easily accessible, low barrier activities that you might bring back into your life? So the idea of burnout, it's kind of an interesting one, because people have this intuitive sense of knowing what it is. People use the term, it's part of the common vernacular, where people will say, I'm feeling really burnt out. And other people seem to have an understanding of what that is, even though it's actually quite poorly defined and people haven't been using the term for very long. It's kind of crept into our existence of how that is a risk for people who work too hard, don't have work-life balance. It's become kind of part of our normal North American working vocabulary. The term was first used in the mid-70s by a German-American psychologist, and he described it as a state of mental and physical exhaustion caused by one's professional life. And there's three components to this. The first one that he hypothesized here is that there's an emotional exhaustion piece of it. So that's the fatigue that comes from caring too much for too long. The second one is a feeling of depersonalization. So you have this feeling of depleted empathy. You don't care anymore. It's really hard to feel compassionate in the work that you're doing. And the third part is having a decreased sense of accomplishment, this sense of futility, feeling that nothing you do is going to make any difference. From the 70s into the 80s, there really wasn't much research in terms of understanding of what workplace burnout was. It was further kind of refined in terms of understanding what the different components of it are, as kind of one well-known study by Maslach, that it composes of emotional exhaustion, cynicism and depersonalization, and then thirdly, the reduced professional efficacy and personal accomplishment. It wasn't really until into the 90s and 2000s when the number of research articles really kind of took off. And now it's something that if you were to look in the published literature, it's a much more common thing that people are talking about. But by and large, this is only a term that's been around for the last 40 years and not into the professional literature until the last 20 to 30. Now, it's important to recognize that burnout is not a diagnosis. It is not in the DSM, the Diagnostic and Statistical Manual for Mental Disorders. It's in the different classification system called the ICD. That's less common in North America. But it's not listed as a disorder. It's listed in the category of things that might influence people's health. And it might be a reason why people might contact a healthcare provider, but it is not a diagnosis. So in the ICD-11, they have characterized it or defined it as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, and it's characterized by three dimensions. And these three dimensions are the same three dimensions, generally speaking, that were earlier operationalized what burnout is. So it's the feelings of energy depletion or exhaustion, increased mental distance from one's job, feelings of negativism or cynicism related to one's job, and then thirdly, the reduced professional efficacy. They say that the burnout refers specifically to phenomena in the occupational context. I've added that underline, and should not be applied to describe experiences in other areas of life. Now, the thing to consider here is occupational context. Occupational context could be defined very narrowly, or it could be defined broadly. A narrow definition could be something like working in an office setting that you earn a salary, of which you have that exchange of services or goods for fees. But you can also define occupational context a lot more broadly. And I would argue that if you are a parent of a young child and essentially your job is to care for that child at home, just because you're not in a traditional office setting and just because you're not maybe earning money to do that, it doesn't mean that that's not your occupation at the time. Similarly, if you are a student, yes, that's not a traditional occupation, but that is your job, perhaps at the time, if you are an undergrad student or a graduate student, that you have responsibilities day in and day out to fulfill your obligations as a student. So that's kind of like your job. And then thirdly, if you have taken off time from your traditional work to care for a loved one, that then becomes your occupation at the time. And I would argue that in all three of those, at least, people are at risk for feeling and experiencing burnout, even though it's not the traditional occupational context of working in a cubicle in an office and earning a paycheck. The definition of what those stresses might be on someone, for instance, outside of a traditional workplace. If this is a parenting role, if we look at kind of what is that parenting role and how does that parallel what might be very challenging workplace conditions. As a parent, if you're looking after a young child, your role is constant. You don't get to walk away at 4:30 or 5 o'clock. You are always in that parenting role. Often in that role, there's no breaks. You don't get to take your lunch break. You don't get to take your 15-minute or 20 minutes in the morning and afternoon. You always have to be on. If you're a parent of a young child, you might feel very socially isolated because of the obligations you have that are stretching your abilities and resources. You might find it very difficult to maintain your self-care. Where might you find time to go to the gym if you have a 2-year-old attached to your hip? At times, the role might feel very unrewarding. You have few freedoms. You can't just drop what you're doing and go and do something because it might be fun. You don't get sick days. You don't get vacation days. There might be multiple demands on your attention at any given time between looking after a child, doing laundry, doing dishes, preparing food. You have lots of responsibilities all concurrently. And for a lot of parents of young children, it feels very indulgent to do things that might be related to self-care or the activities they might find rejuvenating. And so they land up not doing those things, which further leads to them feeling chronically stressed in the role that they're in. So if you have all of these characteristics of being a parent of a young child, if those are all the characteristics of a job that you have, of course, it would be easy to imagine that you'd be at risk of burnout. There are no jobs that create the kinds of demands on a person as do parenting. So this is why I would argue that the risks of burnout are similarly parallel outside of the traditional context of an office environment. And moreover, a lot of parents do feel that the stress for them is overwhelming most days compared to about a quarter of other adults. So it is something that is fairly prevalent. So what is burnout and how does it evolve? Well, burnout is important to recognize that it's the result of a number of stressors that are exceeding someone's capacities over a period of time. So the stressor are the things in the environment, the circumstances, the demands that are placed on the person that they have to then fulfill. The stress, on the other hand, is the person's reaction to those demands that are placed on them. And so that stress is physiological stress. It is kind of the mental stress that develops. And so if you consider that things are going well, maybe at work, and you're keeping up with your demands, and then the demands increase, people have the ability to shore up additional resources to meet the demands at the time. If this was a short deadline, you have to work a few hours extra, for a few extra days, maybe work through a weekend, stay up a little bit later at night. These are things that people have the ability to do. People can pull on those resources in the shortish term to meet those demands. But if those demands continue and you don't get the respite to recharge, then what happens is that those additional resources that your body has pulled on, they become depleted. You become exhausted, and there's no way that you can continue because you've just essentially run out of steam. And that's somewhat like the fight or flight response. People can shore up the resources they need in a very short period of time in order to do the thing that needs to be done in order to survive, but you can't keep up that fight or flight response for a long period of time. So burnout tends to develop in stages. And so when you look at burnout, none of this is going to happen overnight. The effects of burnout are largely due to the ongoing chronicity of it as opposed to the acute crisis. When someone's in acute crisis, that's not burnout. Burnout is when the demands placed on someone in the workplace continue over time. So there's one conceptualization of this that has 5 stages in terms of looking at it from the traditional work environment. First is you start a new job. Maybe there's excitement at the beginning, and you're in that honeymoon phase. Then the reality of the stress of the job sets in, and then you could look at how well you're coping, or if you don't have good coping or the demands are too high, then it progresses to being more chronic, and eventually you feel burnt out, and then that burnout sinks in and becomes habitual. So we'll look at each of these components in a little bit more detail. So the honeymoon phase, that's the initial step. So you've started a new job, you have lots of excitement, lots of energy, maybe not all of your full responsibilities yet. You have the support maybe you need to learn the new skills. And so that is kind of the initial part of a new job. Then the stress sets in. And when the stress sets in, you either have a manageable amount of work, or if it's too much and you don't have healthy coping, then you're going in the trajectory of risk of burnout. So when there's greater demands on what someone's capacities are, then their life becomes a little bit more limited to accommodate those additional work demands. So people might prioritize work over and taking care of the work obligations over their personal needs. People might then at that point, because things are getting to be a little bit off balance, is that there's the onset of some stress-related symptoms. So they're still functioning, reasonably well at work, but they might feel a little bit more irritable, a little bit more difficult to concentrate. They might start to get some stress headaches. Productivity might start to decline a bit. They might notice some changes in their sleep or their appetite, feeling a little bit more anxious, and they might become a little bit avoidant of decision making. But generally, people are still functioning for the most part okay at work. Now that can change when that stress becomes more chronic. People might start to feel frustrated. They feel like a failure. They can't keep up. They feel powerless to change. And whatever effort they try to do to put in to meet the demands of work, it seems like the stress just doesn't go away and they feel incapable and incompetent. They might start to procrastinate and start avoiding certain tasks. They feel physically tired and exhausted, resentful, cynical. They might start withdrawing socially, and they're not coping well at this point. And so they're starting to use things like alcohol and drugs to help manage the feelings that they're having, which is obviously maladaptive. They might start to feel more aggressive, more irritable with their partner. And at this stage, they might not fully yet recognize that they have a problem because it's been progressively creeping over time, and they're not yet fully aware of the impact of their work stress on how they're functioning. Now, the next step is burnout. So as we talked about earlier in terms of the conceptualization of what burnout is, there's apathy, despair, disillusionment, and people become resigned and indifferent. So this is beyond that acute phase of feeling stressed with work, but now there's a pullback, and they've kind of, it's a bit of learned helplessness that they really can't do much, and what's the point? The chronicity of the stress at this point is going to play a toll on their physical health. They might start to develop GI issues, chronic headaches. They're going to isolate even further, doubt themselves, feel pessimistic, and there's can be some neglect of personal needs and self-care. And when this continues, then those effects become more entrenched. So more entrenched physical symptoms, more entrenched emotional problems, and that what might have been a transient adjustment issue has now become a full-blown depression, sadness, fatigue, and the health-related issues related to that. I would hope that people would, if they recognize it earlier, seek help, because it's going to be a lot easier to unwind, the effects of burnout earlier on. But this is more likely when people might recognize that they've hit, quote unquote, rock bottom, and they really need to make a change because they're very much struggling. So I work from a CBT framework, and so I look at things from three different categories of thoughts, feelings, and behavior. And so this is how people might recognize that they are progressing in the direction of burnout and that they need to start doing something different. So some of the thoughts that they might have is they're feeling overwhelmed. I can't do this anymore. They might have some self-doubt about what's wrong with me. Why can't I keep up anymore? I should be able to keep going. They have expectations of themselves that they just ought to be able to do it, but they can't. They're worried about being perceived as a failure, that people are going to think that they're incompetent. They feel overwhelmed. They just don't know where to start. There's just too much going on. And they start setting contingencies on, I will get a break when I finish this project. And so setting up those contingencies for when they might be able to rest, it's almost like saying, like, I'm not deserving of rest until I'm able to complete this task that is quite overwhelming for me. And if someone is stagnating and that they can't get their work done, they will never get the rest they feel like they can only get when they've completed a certain number of tasks. The feelings they might have at the time: shame, guilt, anxiety, feeling overwhelmed, fatigue, dread, sadness, irritability, feeling unmotivated, lots of different types of emotional symptoms people might experience. And then on the behavior side, people's sleep and appetite will become more dysregulated. People might be sleeping a lot more or less, or waking up in the middle of the night. So their sleep's going to get disturbed. You might be eating a different type of food, maybe more junk food, just to get the calories, because you hope it might make you feel better just in the short term, or you might lose your appetite. The important thing is that there's a change in the food and what you're eating and your appetite. Changes to attention and concentration. You might find it more difficult to be as productive as you were before, because it's really hard to focus and accomplish the work that you need to do. There might be some avoidance and some procrastination over trying to get things done, because you've learned that whatever the point is of trying to get the things done, inevitably you just get hit with more work and it's more overwhelming. And so what's the point? As we mentioned on the previous slide, substance use can become a problem. People might feel short-tempered, which constrain relationships. Then people feel more socially isolated. And as I mentioned earlier, with the poor concentration and attention, is they become less productive. Some of the physical effects of burnout: if you are chronically stressed, your immune system is going to suffer. So you might be more prone to developing colds and flus. You might have increased blood pressure, headaches, chest pain, the sleep issues, weight gain or loss, digestive issues, and then the very long-term effects of severe chronic stress is going to be heart disease, heart attack, and stroke. And so these things are not without serious consequences. How do you know that someone has burnout? And this is really tricky, because there's no single measure of burnout. We have screening measures, but part of the trickiness of this is that there's not a singular accepted definition, because it's not in the DSM. It is not like trying to measure major depressive disorder, where something actually has a number of specific criteria and thresholds in order for someone to meet that criteria. There's a number of different conceptualizations of what burnout is, and so it becomes a little bit tricky to measure. The MBI, which is probably one of the most common measures or screening measures of burnout, which maps onto the ICD definition that we talked about earlier, is one potential tool. But again, just because someone might score high on a single tool doesn't mean that they have that condition. This is only one source of data. And there's a number of different limitations to the screening measures that do exist. Firstly, they're not diagnostic tools. Any diagnosis or formulation or decision that someone has a particular problem, whether it's a diagnosis or not, the information has to come from multiple sources, not just a singular screening measure. The measure sometimes can be misused. It's not an organizational tool that an employer can give out to 1,000 employees as a metric for how well we treat our staff. That's not what it's intended for. The cutoffs in some of the screening measures might be somewhat arbitrary. If a maximum score on a particular screening measure is, say, 20, where would be the justification for why someone who scores 16 does meet the threshold, but someone who's 1 point lower with a 15, that they don't? What would be the clinical kind of meaningfulness or significance of a 1 point difference when that measure was, probably well-meaning and based on something, but also to some extent partly arbitrary because it might miss people who do qualify for having that condition, or it might miss people who do and not, in terms of the type 1 and type 2 errors that could occur. As well, one of the challenges here is that if you're to give people multiple of these screening measures, if they were measuring the same construct, the same thing being burnout, you would expect that they would have a really high relationship between the multiple measures, but that's not always the case. And so that means that there's obviously some error or some differences in conceptualization or the weighting of certain components. And so the screening measures that we have are not perfect. And then lastly, what are the screening measures? What are they predicting? Are they predicting some future outcome of what might occur, that someone is at risk for developing burnout, and that if they keep progressing, that they will become burnout? Is it predictive of what a bigger, more inclusive, thorough assessment might pick up on? So there's kind of questions about, well, what are you ultimately measuring and what does that predict? And then the last challenge with screening measures is, because generally screening measures are looking at one particular condition, is that it's not also ruling out other potential differential diagnoses. So if someone is completing a screening measure and it's looking at, well, are you feeling physically fatigued? Do you have low mood? Are you feeling more irritable? Those symptoms are, somewhat general, and those could indicate any number of a range of different things. And so if you're only measuring one condition, you're missing out on the differential diagnosis of what those indicators could actually mean. It could be that there's sleep problems or anemia or chronic fatigue, depression. And so it's hard to actually, rule out other competing conditions when you're only using a screening measure on its own. Now, why would some people tend to develop burnout and other people wouldn't? You can put 100 people into a workplace, and not everyone is going to develop the same effects as everyone else. So there are some internal characteristics of people that put them at risk of burnout, as well as there are some environmental and workplace factors that as well would put people at increased risk. On the internal side, people who have a tendency to tie all of their self-worth to their job are going to have an increased risk, as well as people who feel overcommitted to their job. People have extremely high standards for themselves and they're perfectionistic. If you're the type of person who has a strong need for recognition of your effort, if you feel irreplaceable in your job, that you can't get a break and that you're the one who has to do everything, if you have a lot of your social life tied up through work and that it's hard to create boundaries, that puts you at increased risk. If you tend to put your work needs above those of your own, someone asks you to stay late one day, even though you might have social plans, putting those priorities higher than your personal priorities might put you at risk. And if you're the type of person who's a people pleaser and someone asks you to do something, and your inclination is always to say yes, then again, you might be at increased risk. In terms of the external or the workplace factors that could put people at risk, there are certain jobs that do tend to put people at higher risk for burnout than other jobs. Over COVID, there was a much higher rate because of the demands that were placed on healthcare workers and the intensity of the work that they had to do under very stressful conditions, that the risk of burnout was very, very high for them. So the types of workplace factors that could increase risk of burnout are things like time pressure, high demands at work, little control over your work conditions, lack of respite or breaks, a lack of a collaborative environment, increasing responsibility, a lack of collegiality or bullying, insufficient resources, unclear expectations, lots of, insufficient, freedom, but lots of administrative constraints. If there's a lack of clarity about your roles and responsibilities, or there's not many opportunities for advancement, that puts you at risk. If there's disorganization or hierarchy problems within the organization, that can also lead to some poor outcomes. Now, in terms of the prevalence, I mentioned that there's going to be differences between different professions, and there's differences between different populations geographically as well. But without a singular definition, it's really hard to make these comparisons between groups unless everyone is measured by the same set of criteria. The prevalence rates, though, they do tend to vary a fair bit. This isn't something that's universal across all people all occupations and all populations. One study that was a fairly large-scale study using the MBI, when they gave it to a large number of employees, they found that about 10 to 15% of the employees met criteria for their definition of workplace burnout across all three dimensions. And then they also found that about 30% were functioning well across all those three dimensions. But the interesting thing about that is that leaves a very large proportion of people, 55 to 60%, that were struggling in one of those three domains. And so if you think about it in terms of a bell curve, you do have extremes where you've got people on either end of the spectrum, but the vast majority of the people are actually falling in that middle where they have some dissatisfaction, they're at risk of burnout, it could continue to progress in a negative way, and they're not fully satisfied with the quality of the work environment and the performance that they're putting out in their work product. To just kind of demonstrate a little bit of the differences between different groups, in Finland, about a 4% rate of burnout. Compared to Turkey, there's about 25%. Among physicians in the US, close to 40%, compared to the base rate of the population being around 28%. There are some medical specialties where the rate of burnout is very, very high, over 50%, and other ones where it's relatively low. So lots of variability. But the thing to remember if you're worried that you might have burnout is that this is something that's unfortunately not uncommon. And there are some practical ways that people can help manage this. There's factors that affect the person, which we've talked about in terms of the impact on the person's mental health. They might feel sad, depressed, anxious, socially isolated. They might resort to using substances to help them cope, which brings on a whole number of other physical challenges, strained relationships. There are medical risks in terms of diabetes and various other health issues. Professionally, though, there's also risks to people's performance at work. It can affect people's performance if you are disengaging and it's impacting your attention and concentration. It can lower your job satisfaction. In surveys asking patients of healthcare providers, how do you feel about the healthcare services that you received? The patient surveys for people who are burnt out rate their satisfaction with their healthcare as lower, lower quality of care. It can result in medical errors if people are distracted and not fully engaging and they're fatigued. It can result in financial costs if people aren't able to work, or and on the systemic side, we'll touch on that in a second. People might be at risk of lawsuits if this was in the US about making major malpractice mistakes. It can result in absenteeism, people calling in sick more than they need to when their mental health is better, and job loss. People can get fired if they're not coping or meeting the demands of their employer. And it also creates problems on the system. If you have people who are becoming chronically burnt out and having to leave the workforce, that puts a strain on the employer, whether it's a hospital or another type of work environment. And then it creates strain because a lot of these professions are already underserved. And so there's already people feeling stretched very thin. And if you have, for instance, on one medical team, some people who aren't able to cope and to continue, it puts further strain on the other people because they have to find a way to cover those other demands. And it can lead to staff turnover, which is very disruptive to workplace teams and training, and it can lead to a lot of downtime between having a fully staffed system. So how do you deal with burnout? Well, when burnout is kind of in those early stages, and it's just that stress stage, just like if you're trying to protect against developing burnout, there's going to be some things that you do at the beginning to make sure that you kind of reduce the risk as much as you can. Importantly at the beginning, because this is going to be progressive, is learning to recognize the signs of stress that each individual person has for themselves. Where you can, try to maintain some boundaries with work. Being protective of your rest time with the same level of commitment that you've had with work. Some people are very committed to making sure that they arrive to work at 8:30 and no later, and that they put in every minute that they need to do until the end of the day. But when it comes time to their free time, the thing that does help their resilience and help them balance their life, they let other things infringe on it in a way that they don't with work. They somehow treat work as more important than being protective of the rest time and making sure that that gets carved out and doesn't get infringed on. When you look at Professional athletes, they build recovery time because they know that to perform their best, they need to also have time to let their bodies rest. Mental work is the same. People need to have recovery time in order to get the most out of themselves. So that's something important to keep in mind and consider. When people are doing things for rest, something I encourage people to do is to think about what are the different things that you can do for rest and how does it actually make you feel rested. And there's a difference between passive rest and active rest. Passive rest would be something like you come home at the end of the day, you throw together some food, you eat your dinner, and then you scroll on your phone for an hour or two, and then you go to bed and you do it over again. That scrolling on your phone for an hour or two might not make you feel as rejuvenated as doing something that might be social with your partner or your spouse, going outside, getting some fresh air and some exercise, doing something you enjoy doing, like playing guitar, going for a walk, whatever it is for you that you find restful and rejuvenating. You might kind of try an experiment and try 5 different things and rate it. How good did I feel at the end of doing that thing? And what do I need to do more of to make sure that I'm making the most of my my rest time? Self-care is an important one. These are some of those things that start to slip when work is taking up more and more of people's energy and time. That things like exercise, making sure they get enough sleep, paying attention to the food that they're eating, those things are part of that slippage where work is taking up more and more of people's mental energy and time. Celebrating accomplishments rather than immediately moving on to the next task. So when you do finish a big project at work, what's the next thing that happens? Do you close that file and open up the next big one? Because you can imagine if that's how things are day after day, week after week, rather than recognizing the end of something and marking that and feeling good about having done good work, is that's going to lead to that chronicity of feeling like it's never going to end. Overcommitment. This is one of those risk factors that some people have, where someone might ask you to do something and you say, yeah, I can do that. But just because you can do something doesn't mean that you should do it. Just because you could stay later for an extra 30 minutes doesn't mean that that's the right thing for you to do. So think about how much you're taking on, and just because you might be able to help something, feel free that at times you might have to also say no, because you have to be protective of yourself and your boundaries and the limits on what you can do. Self-compassion is another important one. If you are feeling discouraged and you start mentally beating yourself up over the work that you're doing or the struggles that you have, being compassionate that you might have more on your plate than is reasonable for a typical person, or you're not at your best right now and you need to scale back, that can help make things worse from that negative thinking and essentially hitting yourself while you're down. For some people, they might try to do more to try to get themselves out. And for other people, the reality is that you need to start doing less. So think about the things that might make you feel more rejuvenated, the thing that might make you feel more rested. And if it's doing more, then that's great. But sometimes for a lot of people, it might be that you have to start doing less. And then lastly, in terms of being realistic and practical and flexible, is that there's also risks in being overly rigid. Right? There might be times when you do have to stay late. There might be times when you might have to work through lunch. There might be times that you have to stay up late to work on a project. So I would just caution against treating this as a kind of all or nothing must do things in all cases, because the effects of burnout are the ones that happen when you do this repeatedly over time without kind of having that chance to decompress and come back to your normal baseline. So how might people guard against those things? Ask yourself, do a self-evaluation, because it's going to be a lot easier to unwind yourself and to dig yourself out if you're catching things in the early stages. One thing that you could consider doing is putting a reminder in your calendar for, say, every quarter, so every few months, every 3 months, have a quick check-in. Take 5 minutes, have 10 minutes, speak with a colleague, speak with your spouse, and take kind of stock about how you're doing. Because if you can catch what might be a little blip, it's going to be a lot easier to undo that than a full-blown spiral. And think about, is work taking up more of your mental energy and time and resources than what your values might dictate? What's important for you? What kind of a life do you want to lead? Because if your values are, to live a balanced life, to spend time with your children and your partner and to be physically fit and to enjoy your hobbies, how might you recalibrate your life so that you're living consistently with the values that you have? So we talk about rebalancing and recalibrating. There's a number of different things that you might consider doing. The personal strategies here is think about what might have slipped as you have increasingly prioritized work over the personal things that you like doing. How might you diffuse stress as it's building up before it becomes problematic? And think about the low-hanging fruit here. You don't have to find a new activity that you might enjoy. Think back to a time when you were doing better, when you didn't feel burnout, and those are going to be the things to try to reintroduce again. Those are going to be the things to revisit. Sometimes I'll hear from people, they say, I haven't picked up my guitar in 2 years. Well, that's going to be the first thing that's going to be easy to do because you know that you used to like to do and you don't have to rediscover it. And I bet that if you had that guitar, it's probably sitting gathering dust in your closet right now. And how much time and effort would it take to pull that out for 10 minutes and play that tune that you used to really like playing? That's an easy thing to do. That's a low barrier way for you to start recalibrating, right? Whatever it is for you, it doesn't really matter, objectively, but this is part of that active rest, right? Finding those things that remind you of the things that you enjoy, and it's not just all about work. Think about the relationships you have. What relationships might you have, found were really important for you in the past that might have slipped? Has it been longer than usual that you've connected with your family, your friends, or your significant other? When was the last time you cooked a meal together with your partner? When was the last time you went out together to the movies? Connect with your colleagues if that's a source of support for you. And think about how well you're functioning in terms of your physical health. If you were a car, you know what you need to operate. But your body is kind of the same. You need to put the fuel in. You need to maintain your vehicle and yourself to make sure that you are functioning well. And then also pay attention to the thoughts you're having. Step back and say, am I having any of those thoughts that might be making this worse? And how might I think about the work that I have to do and my life and my priorities? They're going to make this easier. If you are a religious or a spiritual person, and that's been a source of support for your mental health, that might be something that you might want to revisit. And then in terms of your work, are there aspects of your work where you do have some control, some things that you might find easier to do, that you get more joy out of doing, that are more satisfying? And are you able to do less of some other things that are really, really challenging for you, even if it's just in the short term? How do you feel about asking for help? Some people have a really hard time with that, but I would suspect that a lot of employers would rather give you a little bit of support than losing an employee. So think about how you might be able to ask for the support you need, even if it's just to help get over a short kind of hump or set of challenges that you have. If someone asks you to do more, don't feel like you have to put on the brave face and say yes to everything. It's okay to sometimes say no to certain tasks if that's permissible within your job description. Think about anything that doesn't have to be high priority. Are there things that can wait? Are there things that you might be able to ask someone else to do for you? Are you able to delegate? Are you taking on way too much? And if you are feeling disillusioned about your job and you're feeling like you don't feel like you're making much of a difference, try to reconnect with the things that at the beginning you found were the things you really loved about it. Don't forget about those things, the things that you found fulfilling, the things that you felt like you were making a difference at, and the things that had special meaning to you. If you are fortunate in that you're in the position where you can exert some kind of change within the organization, or you're an employer and you're worried about your employees having burnout, think about what might you be able to promote autonomy of your employees? What might you be able to do to engage them in decisions that affect their functioning within that organization? Are you able to engage them in changes to different policies or procedures? Might you elicit their feedback and listen to them to help them in ways that might support them to do their jobs in the most efficient and effective way? Do your staff have the resources that they need? Might your staff be saying no because they're worried about being criticized or being viewed as incompetent or struggling? Can you promote a collegial work environment? Can you provide some flexibility around scheduling? What does it mean if someone has to leave early one day because they want to attend their child's performance? Do you allow them to work later on another day, or do they have to take an entire day off and miss out on another proper vacation day or work for the day? So being able to accommodate people's real lives day to day is important as well. As well, making sure that you recognize when people are doing good work. Don't only speak to them about their work performance when you see problems. It doesn't have to only be when they're making mistakes or that they're struggling that you make note of their performance. When you recognize good work, make sure that that's recognized and acknowledged them as well. But also consider what happens when someone is tasked with a really challenging project, for instance. What happens when they finish that really challenging project? Do they then get a harder one? Do they get more work? Do they get more responsibilities? What's the consequence in terms of them doing really, really good, competent work? And how might that affect their motivation to continue? So when to seek help? This is really important because we've talked about burnout and the various steps that kind of go towards burnout. But as I mentioned a couple of times, um, burnout doesn't have to be full-fledged before you seek help and start to try to reverse it. If you've tried on your own and you're not feeling like you're making any progress or enough progress, that's a great time to try some of these things or to reach out. If you feel like you're on a path and it's progressing and you don't know how to get off that road and you're going towards burnout, great time to seek out some help. Have other people expressed concern about you, whether it's your people in your family, your partner, other people at work. Even if you don't necessarily see it yourself, maybe someone's noting this to you and they're asking how you're doing because they're seeing something that you're not. So be open to that possibility. And also think about whether you're feeling burnout has affected your daily functioning. Are you doing as well day to day that you were in the past, maybe earlier on in your career? Are you feeling depleted? Are you feeling exhausted? Are you feeling more distant kind of mentally from work? You're less engaged? Are you feeling more negative and cynical about the work? And are you feeling less professionally effective? You might feel like you need to make a change, but you don't know where to start. That's sometimes a bit of the problem too, is that people understand that there's a problem, but they just feel like they don't know where to begin. And that's sometimes helpful then to get that outside feedback in terms of organizing and figuring out the priorities and where to start. And a psychologist can help you with that.
Can you talk a little bit more about what the impact of COVID was on burnout?
Absolutely. I mean, you think back to what people were experiencing, during COVID. There was a lot of uncertainty. There was a lot of anxiety. There was great concern that the demands on the healthcare system would far exceed its capacity. And people were worried about getting sick themselves, what it might mean for their own health, for their families. People were feeling disconnected from each other socially because we had to isolate. It was really hard to do a lot of the recreational activities that people did. So it was this almost perfect storm in this recipe for people, especially those who had to continue to work in the same way that they were, with exceptionally high demands, far greater than they probably ever experienced before, without all the benefits that they might have had to recharge and reset in their home and personal life. And so those demands, they didn't have the opportunity to, take vacations, call in sick, spend a lot of quality time with their families. And what might have been a typical client load for them, the worry at all times was there's going to be a spike, there's going to be a flood of cases that are going to come in, and there's no one else to deal with this other than me, and to potentially put your own health at risk to do so. And that's why there was that outpouring of support for people to recognize those efforts that we had, people banging on pots and pans at 7 o'clock, because that was hopefully, that encouragement and that show of support in that very small way to recognize that people were feeling the strain and for that to be acknowledged and appreciated.
Do you have any tips for talking to or supporting a partner who's experiencing burnout but not willing to seek help? Have you got any tips?
I mean, that's a good challenge, and I think that there's the various things that a partner can do outside of the formal therapy that someone might be resistant at the time to engage in. And I think that engaging a partner in doing the things that they used to like to do together is a good behavioral set of strategies without kind of doing the more intense emotion focused work that might be more difficult for someone like that. So if you know that they used to like to go hiking, they used to like to go camping, they used to like to go for walks, they used to like to cook meals, think about the things that they used to do that maybe they're doing less of right now, and help support them and do that together with them, to help lift them up a bit. If they haven't seen their friends for a while, maybe give them a night off from parenting responsibilities so that they have a chance to connect with their friends. The small little things can build up over time. And I think that if you think about what would be as I mentioned in the presentation, the low hanging fruit, what are the things that they were doing when life was going better for them? And how can you help support them to start reintroducing those things back into their life? It's important to remember that burnout's not the diagnosis. Burnout is a set of circumstances and how people might react to those circumstances that can affect their mental health. So that's important to kind of conceptualize on its own. Now, if someone has burnout and they're progressing in that direction, it might affect their anxiety and mood to a point that they might then qualify for a diagnosis of an anxiety, an adjustment disorder, anxiety disorder, depression, substance use disorder. All those things become increased risks as a result of burnout. So when I mentioned that it can be hard to find where to start when you're feeling burnt out, that's something to keep in mind is I don't need to find a week to get away on a vacation. I don't have to have thousands of dollars to go on a cruise. And that's not going to make the big difference because you're just going to return to the same set of circumstances and work stresses that you have. But what are those small, easily accessible, low barrier activities that you might bring back into your life that might have been squeezed out because work has a way of coming in and then you prioritize it and it squeezes everything out? How might you create a little bit of space in your day-to-day, your week-to-week life that lets those things come back in and helps create that balance again?